My mom was a very strong individual, very nurturing, very caring, and she had had this cough for a while. So, she said, I'm gonna go get it checked out. Went to the doctor. They took a chest X-ray and saw that there was a nodule on her lung. They decided to treat it with antibiotics, assuming that it was an infection. Her cough got a little bit better, and so she took that as, hey, it was probably just an infection. Unfortunately, nobody followed up with it. And so 6 years later, she goes into the hospital, into the ER with severe hip pain. They take an X-ray, they find a mass on her pelvis, they biopsy it, and it ends up being stage 4 lung cancer. Seeing someone who was active and strong go to a point where, I'm out in California visiting her, sitting on the porch with her, and, she's in a wheelchair. The cancer had started eating away at parts of her spine. She's all contorted. She's having a hard time breathing. And the reality is at the end, she did suffer. I don't want anybody else to have to walk through that. And 74% of lung cancer right now is caught in stage 3 and 4. And so at stage 3 and 4, it's difficult to be able to treat these things. So at Medtronic, what we're trying to do is we're trying to flip the script. We're trying to catch this in stage 1 and 2. So within the lung health program, we have the ability to use our Lumicite platform. And we also have Lung GPS, which is a software that integrates into the hospital's database to find all those patients who had incidental lung nodules that were never followed up on. So I talk about me going into a hospital and making an impact, that if I would have known what I know now, my mom would be alive. If a Lumicite and if Lung GPS was installed into the hospital and the primary care physician that they went to knew about this, they would have referred her. They would have said, hey, listen, we need to follow up on this nodule. And it's a powerful statement. And at times I can get emotional talking about it, but my mom would be alive right now if I would have known what I know now. And so that's the driving factor behind why I'm doing. And that is truly what gets me up in the morning to go to these accounts, to go to my hospitals, to work with my doctors, to build these lung nodule programs, to make an impact in their patients' lives.